Welcome back. I'm joined by Harrison Fleming from secondstreet.org as we unpack some recent research that displays or demonstrates that many Canadians are actually interested and have an appetite for private health insurance. So, Harrison, thanks again for joining me. When people hear the word private associated with anything health-wise, some Canadians get their backs up. They think immediately two-tier. Is integrating or introducing private health insurance in Canada going to create a two-tier system, whatever that is?
Well, I think the most important thing to address there is there's already a two-tier system in Canada because we already see about 10% of our population today is choosing to purchase healthcare and healthcare services outside of their home jurisdictions, which means paying for it privately. So we already have about, like I said, about 10 to 11% of the population spending this money. So the question is, why are they spending it somewhere else? And is there a tangible benefit if they were to spend that money within Canada? So when we talk about two-tier healthcare, we often think about, oh, all of the talent is going to leave the public system and move to the private system, or alternatively, the best care you're going to get is through the private system as opposed to the public system. So a lot of people see the opportunity of some private players in the healthcare system as this assault on public healthcare. But it's really important we look at countries where this is happening already. Because what we see in France, in Sweden, in the United Kingdom, in Germany, in Australia, the list goes on, is a perfectly functional and successful healthcare system run by the taxpayer, the public, the government, with private options. So we're not seeing this calamity happen. And even if there is some concern about staff migration from the public system to the private system, there are already backstops that exist in many of these countries. For example, in the United Kingdom, there's contractual obligations that you have as a healthcare provider. If you want to work in the NHS,
Mhm.
you have to prioritize some of those NHS procedures. So there's ways and important lessons that we can learn from some of these countries that have given patients that choice. But again, to say that Canada doesn't have a two-tier system already, it's just not true. Wealthy Canadians can pay out of pocket and travel internationally for care that
Right.
costs tens or hundreds of thousands of dollars. By allowing private insurance available to the general public, what you're doing is you're creating that option and that opportunity for so many more people.
Right. And that to me seems obvious. I mean, you can go on social media and hear people video vlog themselves going to Turkey for facial procedures or cosmetic procedures. I mean, people are traveling. There really is an international market for all of these things because it's either cheaper or quicker. So it's interesting. Talk to me about the economic benefits of bringing in private health insurance. How would private health, so just offering that choice, how would that impact our economy?
Right. So we took a pretty close look at this by examining companies like Kaiser Permanente, which are large integrated healthcare providers internationally. So that means they provide insurance, they have clinics, and they have hospitals, and they provide healthcare and everything in between. So looking at something like that is sort of what we were building this model off of to say, ground up, these guys run everything. So
Hmm.
if we're going to look at the amount of employment that could come, let's look at what their numbers look per $1 billion of investment creating jobs. And what we saw was about 39,000 jobs. Now, this is, and I should be clear, it's a conservative estimate, which is always the safest thing to be, right? You don't want to say some
No.
crazy number and have to be wrong, but it's definitely at least 39,000 jobs. And that means not just new people to run insurance buildings in downtown Toronto, but we're talking about hundreds, if not thousands, of new opportunities for medical professionals, for doctors, for nurses. And there's an opportunity to actually say to our medical schools to say, let's crank out some more doctors. Let's encourage you guys to pump out more medical professionals because we have all of these new roles, because we
because
have this opportunity.
because correct me if I'm wrong, but there's a hesitancy to increase the number of doctors that we graduate because there simply aren't enough operating hours or operating rooms, and I assume that's because of money.
Correct. Yeah, the healthcare system simply has to ration the amount of care that's available, which means that existing doctors If there's 50 specialists, those 50 specialists are doing a number of cases. They don't want 51 specialists because they're going to lose some of that opportunity to build a government for that care. And there's
Right.
also a limited pool for that money to come from. So they might be losing out on other patients. Whereas again, if you create an opportunity for the private sector to become a player, you're creating new opportunities for people to engage in this market. You're creating new jobs in the market. And at the most important thing, you're giving patients faster access to care.
And choice. My goodness, I love choice. Let me decide. I don't like people deciding for me. I like to be the author of my own future, that's for certain. We're going to unpack a little bit more of this in our last segment once we return from commercial break. Please stick around.